Good afternoon, everyone, and welcome to today's presentation, Management for Elders and Their Caregivers. My name is Migdalia Gomez. I am the AVP of Community Engagement, and I'm joined with my colleagues Sarah Scruggs and Dominique Verdieu, and they are our Community Engagement Specialists. And the three of us are your Community Engagement team here at the Harvard University Employees Credit Union. And we are here to help provide personal finance education to you and those in your families and households. Today's presentation is one of many that we have with Boston Children's Hospital. And just where you were able to register for this one, you're also able to register for others and also view the recording. So if you have to jump off today's webinar or maybe you missed another one, you can always go onto our website and be able to view the upcoming workshops or the ones that you missed. So I mentioned that we're the Harvard University Employees Credit Union, but what exactly is that? What exactly, or who exactly are we? So we are Harvard's not-for-profit financial institution, and as a not-for-profit financial institution, it really means that the focus is on you, the member. It's on you, the community. We are not in the business of making profit. We're in the business of being of service. So we're able to provide better value by having lower rates on loans, higher rates on savings. We're able to provide better service. At our institution, people know you name by name. We are also able to provide much more detailed service and really focus on that not-for-profit piece, meaning that if you come to us and you have a better offer somewhere else, we're going to be the first to tell you, oh yeah, that's a great offer, go with them. We care more about you as individuals than we do as a not-for-profit. As a for profit, we care about you more as an individual than looking to just make profit off of our community. And as a not-for-profit credit union, we also have a board of directors that are volunteers. They are not paid. They put their time into really looking at doing what's best for the community and its members. That's all that I will say about the credit union, but Sarah did put some information in the chat if you want to learn more about the other workshops that we have had. So today's presentation is one that we actually created and started working on because of member feedback. That is really important to us. And today at the end of our session, we will have a survey for you to provide feedback. What other topics are of interest? What could we elaborate on? And one of the topics that came up a good amount of time was caring for elders and the financial aspects of that. And that's really what we're going to talk about today. And I want to first say that one of the biggest pieces of this conversation, even though, yes, I'm here, Sarah will also jump in later and provide some additional information or throughout if she has something to say in one of our slides. What, what we're here to say is we're here to provide it from financial piece, but ultimately we are talking about cared ones. These could be our parents, they could be our relatives, our friends, and these are people that we're caring about. And even though, yes, this conversation that we're having is about the financial piece, the most important conversation that really needs to happen is with the one that you're caring for, the one that's cared for, or not only how do you want to care for them, or how do you want to be cared about, how do you want to be cared for? So it's really an important piece to just take a moment and acknowledge that this is about the individual. It's about those that we're caring for. And as with any financial decision, you want to start with the conversation, but especially in these cases, making sure that when you're coming up with a plan, you're really focusing on what your loved one wants, or if you're the one that's being cared for, what is it that you want? I also want to mention that there are a lot of expenses when you think about caring for elders. And of course, you have your medical expenses. So, doctor's visits, if you are in a position to have home health care and nursing home support. But for our presentation, we're not going to focus on those medical pieces. I mean, your hospital professionals, healthcare professionals, you know that healthcare advice should come from healthcare professionals. So that is why we will not be providing that type of details. You have a vast majority of resources available to you. So we're going to leave that to those folks that are the true experts. The same goes with the emotional well-being. We don't want to go gloss over this or not give it the importance that goes into this. When caring for an elder, as when as with caring for anyone, whether it's an elder, a younger person, a peer, that can take a lot on your emotional well being as well. And we want to acknowledge that. We want to let you know you're not alone if you ever feel, or in the future have felt, feel, or will feel stressed about this, may feel. Some people sometimes may feel a little bit of resentment. Some people may feel guilt. There are a lot of emotions that are associated with just caring for someone else. And we want you to know those are normal. You have support. Check with, I'm sure through the workforce office, there may be resources, employee assistance program, there are religious groups, cities. There's so many different resources that are out there, many that are free or very low cost. So as you're taking care and planning for the financial piece, which is what we'll discuss, make sure that you're also focusing on your emotional well-being and that you're also being taken care of as well. And one of the great pieces with these different groups that are available that could provide support to you is many times they can also provide resources. So not only do you get a space where you can discuss some of your concerns that you're experiencing, but you could also sometimes get resources to help you manage some of these, not only financial, but other pieces that go into caring for our elders. And finally, the piece that we're going to talk about is really the financial support. As a financial institution, that is really where we can lend our expertise and where we're going to spend the rest of our today's presentation. We're going to really be discussing financial needs, resources, and just considerations as you either are being taken care of or are providing care for those elders in your community. The first step that I would recommend taking is estimating your financial needs. And estimating the financial needs, it's one of the most important steps because once you have an idea of roughly how much you may need, you'll have more direction as to where you could go for support. Now, with financial needs, medical bills is probably going to be one of the biggest ones to consider for managing elder care or managing the costs of aging. If it's for you as an individual or if it's for someone that you're providing care for, a couple of years ago, and I wasn't able to get more data that was a little bit more recent, but from 2019, I was able to pull some data that showed that for a couple that's in retirement through the life of their retirement, they're going to be spending about $285,000 in healthcare cost alone, and that breaks down into about $150,000 for women and $135 for men, and this is a couple that men and women for same sex, and it adjusts the numbers accordingly, but 150 for women and 135 for men through the life of their retirement, assuming they started retirement at 65 years old. Everyone's situation will be different. So for some people, medical bills may be significantly less. For some, it may be higher depending on other other conditions that may arise, other conditions that you may have going into retirement. So it's one of, however, the most expensive one. It's usually one of the ones that people tend to under save for because many times they'll think, oh, my insurance will cover. And that is true. Insurance will cover part of it. Medicare will cover part of it, but it usually does not cover 100%. And even with Medicare, you still have to pay for parts of it. For most people, you're not getting Medicare 100% for free. You may have to pay for the prescription. You may have to pay supplemental co insurance costs. So there are other pieces to consider. The other ones is the type of lifestyle that you want to have or that the elder that you're caring for wants to have. What will they be traveling? Will there be taking part in hobbies that perhaps are costly or entertainment? I know of a couple that has been retired for a couple of years now, and they love going on cruises. Of course, they didn't during the pandemic, but that was something that they did a couple times a year. They would go on a cruise three to four times a year. They really they're big cruisers, and they are planning on going back. But that is a pretty expensive trip for them. They sort of go on the nicer cruises, they get the nicer room. So it ends up adding up. But that is their primary form of entertainment and travel. It's and hobby. It's all in one. So for them, they sort of really budget for that. And when they're not on these cruises, they're mostly home, not really spending on other pieces. Everyone's situation will be different. For some, their hobby may be gardening, and gardening can get expensive, don't get me wrong, but it may be a lower cost hobby. Make sure though that when you're estimating, you're allowing for room for growth, for opportunities for volun- other hobby opportunities, or travel. So you don't want to create a budget that is too strict that won't allow the elder or yourself room for flexibility, because as we age, just even, regardless of what age you are at, but as we age, our interests may change. So you don't want to say, oh, I'm not going to have any hobbies, budget a small amount, and then maybe 2 years later decide, oh, actually, yeah, I want to pick up this hobby, and realize that you didn't budget accordingly. The other piece when estimating financial needs, and one that can go both ways, I've seen, is housing. And specifically, are you going to be relocating? Are you going to be having any renovations? For some, especially those that are homeowners, they may choose to downsize their home. But when will that happen? Will it happen right when they go into retirement? Will it happen a couple of years into retirement? Have they paid off their mortgage? If they haven't, what will they do? Will they pay it off and then relocate? So these are all questions to have, and questions to bring up as you're having your conversation, as before you start putting the numbers on papers and estimating the financial needs. So a lot of, again, conversation is going to be the big piece. You never want to do this in a vacuum. When I have a conversation with those that are involved in the elder care's life that you're caring for. And then for some, sometimes relocation may end up being a little bit more expensive than anticipated, even though in the long term it may be less expensive. I know here in New England we have a lot of folks that will go south. They'll go to Florida, where the cost of homes significantly less than here, depending on the type of home, of course, and the location. But there is still the relocation cost. There's still the moving. Are you going to get a moving truck? Are you going to buy new furniture? So there are other costs to consider. It's not just, okay, I'm going to maybe I'll rent an apartment versus buy. But regardless, like, what's the furniture going to be? How are you going to get things down there? What are the sort of initial costs of that relocation? There are some individuals that may look at doing a reverse mortgage, and reverse mortgages may be a good choice for some. It may not be the best choice for others. Essentially, what a reverse mortgage is, let's say that I have no mortgage on my home. I've paid off my home in full. I could choose to have that value of that house put into a mortgage where I get the funds while I am alive, and then when I pass, or whoever is in that household on that mortgage passes, that mortgage, that house is now a property of the institution that I took the mortgage with. Now, for some, that may not be the best choice, because if you are looking to leave assets behind to loved ones, that would not be an option. So, for estate planning purposes, that may not be a good option. And then there are some other considerations for some other folks. It may limit your ability to have other options in the future. So, if you change your mind, you may be more limited at what options you may have available to you, or if the time of the mortgage doesn't sort of coincide with the life expectancy that you had predicted. So there are considerations, but that is something else to bring up as part of the conversation. And then you're going to have legal costs and funeral costs, which are the costs that, as most of us, we don't want to necessarily think about those costs, but they are real costs that it is, the more thought that can be given to it now, the better it will be for the family, for the friends, to not have to think about later when the loved one passes. And just for a little bit about funeral costs. And so for funeral costs, you're probably looking, and every situation is different, but around $10,000 is a more or less sort of average. So just to give a little bit of context, as when you're thinking about estimating what those financial needs will be, it most times tends to be more expensive than what we anticipate. And that's one of the reasons that planning now is a benefit. And I'm so glad you're on this webinar. That way we can give you some tools so that you can get the information ahead of time. And I know I'm going through a good amount of information, so if there are any questions, you're more than welcome to use the questions panel, which is on the right-hand side, or top navigation. It sort of depends on what platform you logged in. But if you do have questions, you're more than welcome to submit them. We are here to provide you the information, and we will send a recording, as I said earlier, but definitely make sure that if you have questions, we're here to help, and please do submit those questions. So now that we have an idea of roughly what our expenses are, how are we going to pay for these expenses, or how will your loved one pay for these expenses? And I do go back and forth because I know for some of you, you may be attending today's presentation as the caregiver. For some of you, you may be attending as the elder that will be cared for. So I go back and forth between, since I know that this is not just one individual, it's multiple folks that are typically involved in planning for elder care. Now, paying for expenses are potential different sources. You have your personal funds, which for the most part, it's really savings and current income. So for savings, it could have been retirement saving. For a lot of folks, that's typically what it is. For current income, some folks may be retired, but still have a part-time job, or maybe they have other income that is coming in that is being paid off of their retirement funds, maybe, or just investments that they have on the side. So really take a look at what are the personal funds that you have currently coming in. For how long do you anticipate those funds will be coming? For some, it may be only for a 5-year period. It may be for current income, for example, they may say, yes, I'm only going to be working this part-time job for maybe the next 5 years. And I'm just always going to make up numbers, for example, but let's say that that person is making about $1,000 a month in part-time job. Again, very limited. It's an additional $12,000, but that's over 5 years. That additional $12,000 a year, taking that into account while they are working, means that they could borrow less if they were considering borrowing, or that they don't have to pull from their savings. So knowing where the funds are coming in from and for how long of a period they'll be in will also impact the planning. Then there's borrowing, which typically something that we don't really recommend as you age, because it may limit what options you have available to you in the future, especially if you are thinking of estate planning or essentially leaving assets to your loved ones and cared for. Now, with loans and credit cards, loans may be a little bit tricky sometimes as we age, because if we don't have income coming in, a lender may not lend to us. So you may be a little bit limited as to what's available to you. Credit cards, especially if you've had them for some time, are usually still going to be available. But with credit cards, the interest rates tend to be pretty significantly high and may not be a good term for long-term borrowing. But if it is something such as a short-term purchase that you can pay off in the next month or two, may be a really good option. So for some of the expenses that we spoke about, maybe like the hobby, maybe it's a expense you pay for this month, charge this month and pay it off in the next month or two. But something that's a little bit more long-term may not be the best option to put on a credit card, such as heavy medical expenses, because having medical expenses on a credit card could really end up costing you significant amount in interest. And then we have the government expected resources or sources of income that are coming in. Now, with government expended resources, I always hate being the sort of bearer of bad news, but typically it's not as much as we anticipate it's going to be. With Medicare, as I mentioned earlier, there are times that you probably will have to pay something out of pocket, depending on your income bracket. But, it still does cover certain expenses, but it doesn't cover 100% for free, at least not for most people. With also, you have Social Security. I know people sometimes plan only on Social Security, but for Social Security, it really does vary how much you're going to be able to bring. Now, if you, just for an example, for 2022, for this year, if someone waited until their full retirement age, which for most is 67, they would be getting about $40,140 a year. Now, for most of us, that's not enough, especially as we age and as we have expenses, medical expenses, our hobbies, traveling. That may not be enough. Rent, mortgage may not be enough to allow us to have the lifestyle that we want during retirement. So it's a great supplement to hopefully other retirement accounts that you may have or personal savings. Now, that $40,000 a year through Social Security retirement is if you waited until the age of 67, which would be the full retirement age. So you would get the maximum. A lot of people, though, will wait until, won't wait, and they'll take out the retirement funds at 62 years. And in that case, if someone took out their retirement through Social Security at 62, they actually would be getting 28,000 a year, 28,368. So a substantial amount less than the 40,000. And that's important to note that that difference of about 12,000, that's again a lifestyle difference. And we're not here to say this is better, this is worse. It's always personal. Everyone's situation is different. We just want you to think about the lifestyle that you or your elder want to live, and then estimate what are these going to cost and what planning needs to go into effect to really help you reach that goal. And then there are private financing. I talked a little bit about reverse mortgage in the previous slide, different life insurance policies, long-term care, trust. I'm not going to be able to go into the details of those. Unfortunately, we don't have the expertise on our webinar to really go into these deep, but there are many free resources available to you. You can check with your financial institution, you can check with an employee assistance program. They usually will have a qualified professional that can speak to these situations and what the options could be that are available to you could be. One of the great resources that we have that we're going to put in the chat for you is the National Council of Aging has a benefits checkup website. It's pretty cool because it allows you to put in your zip code, a couple of basic information about yourself. You do not have to create an account. You can if you want to, but you don't have to. We're not suggesting that you create an account, but you can put in your information more generally speaking, such as again your zip code, and you'll be able to see what you have available to you to help you not only save money, but also to help put you in contact with other benefits. So, for example, you can get discounted utilities, perhaps. You can get uh, food discounts. If your income isn't enough to cover the expenses, you may be able to have supplemental income options available. So it's a really good resource to go to. It's benefitscheckup.org. Again, that's benefitscheckup.org, and you can use it anywhere within the country because you're putting in your zip code. So it's going to pull that information for you, and it's going to have it a bit available based off of your specific region. That tool is also really good if you're thinking about relocating. Not only could you do it for your current, but you should also probably do it for where you're thinking of relocating to so you can see what could be available to you. Now, with aging, one of the pieces, especially when we're thinking about, again, about our finances and how to help manage all of that, is knowing what accounts are open. I've worked with a lot of families, and sometimes they don't quite know what the elder had open. They don't know what credit cards they had. And, this I also see with younger folks. So this is not an issue with age. All of us, we may sometimes become a little too busy and not realize, oh, I thought I had closed that account, or whether that's a credit card, a checking account. So one of the things that is good at any age, but especially as we're thinking of caring for those that are our elders, is knowing what accounts that they have open. One of the resources that you have sometimes that you can do is you can actually go through the state of Massachusetts through the Treasury office and see if I think they call it's free money lookup. I think it is. I'll put in the chat later, but you can actually see if you may have money that's still available to you of an account that you thought you closed, but they closed it on your behalf. So sometimes, it's something that we do here at the credit union. Every so many years, we have to go through, and if an account has been abandoned and we issue a refund on the behalf of that individual, and it sits with the state until that individual claims it. So there may be times that an account was open and it was closed, you aren't aware, and you may have money that's available to you or that elder, that family situation. So it's something to know what accounts are open. Sometimes too, because for the accounts that are open, if it's a credit card, it's really easy to know if you pull a credit report. Like you can pull a credit report and you'll be able to get access to any credit cards, any loans, any debt accounts that you have open. It's not quite the same when it comes to savings and checkings accounts. Those are going to be a little bit harder, especially accounts such as retirement accounts. We know of a lot of people that sometimes retire and they don't know that they had a retirement account from the first job that they had maybe 50 years ago. And, if we think about it, that sort of makes sense. For a lot of us, as we age, we're going to have multiple employers and we may not always remember where we had a retirement account, which ones we closed, which ones we transferred over. So it is a good idea to just kind of sit down, go through the history of where did I open an account? If you're not quite sure, you can always contact your old employer to see who's still managing those funds and if you have any funds that are available to you. And know the importance of account ownership and access level. Now, if you are caring for an elder, let's say you're caring for a parent and you're not on that account, you're not going to be given access to help manage that account. And that is 100% fine. That could be something that, your parent decides, yeah, I don't want you to have access. I'm good with managing my finances. That's fine. But have the conversation. At what point would you want to share access? Would they want to share access? Or if they don't want to share access, what are some steps that could be put in place? And Sarah will talk a little bit about fraud, but what are some steps that could be put into place to make sure that no one is taking advantage of your parents' kindness and maybe utilizing their account information? Maybe it's compromised. So want to have those conversations of who has access to the accounts and at what point as the parent or elder ages do you want to maybe add yourself or another caregiver onto that account so that you can have an idea of what is going on with the account. There are things that you can consider such as the power of attorney, titling of accounts, estate planning, so that you're in a situation as a caregiver to have the ability to make choices that are fiduciary choices that are in the best interest of the elder. Should there be in a situation that, sometimes it could be dementia. There are many reasons that, it could be health related. The elder may be in a situation that unfortunately prevents them from accessing their accounts, but the funds are necessary. And this is where a lot of where we've discussed so far, it will be beneficial to work with professionals, work with those that are qualified, that they have the licenses, that they have the certifications, that they have the expertise to really understand what are the specifics for your family situation, or if it's not family, for the caregiver and whether it's friend or acquaintance that you're caregiving for. I mentioned the fiduciary piece. You want to make sure that they are fiduciaries, which mean that they're doing what's best for the elder. It's not about making money off of anyone. It is about providing the best service for that elder. The other piece too, estate planning is really important. And with estate planning, I sometimes hear people say, "Oh yeah, they created a will. They were, they downloaded a will off the website of a website. They paid for it. They created it. They have some witnesses signed it, so we're good." Not necessarily. So estate planning is much more complicated than just creating a will. Having a will is a great document. It essentially tells you what are the steps that you would like taken upon your passing, but it still has to go through probate. It still has to go through the court. It is public information. And it also means that it can delay when the funds make it to those that may need the funds to essentially pay for things such as your funeral or other expenses that may come up. So having a will is an important piece of it, but it's not always the best case for everyone. And there are other ways that you can give access to your estate that can bypass going through the court, such as titling or putting beneficiaries on your accounts. So that in the case of, let's say, my passing, I have a beneficiary, so they can then have access to my funds much sooner than if I didn't have a beneficiary or if I just had it listed on a will, which then has to go through the court system. And then trustworthy financial institution. This is for everyone, again, regardless of age. As is to the estate planning, I just want to go back to that for a moment. many times we think of estate planning not only for elders, but really, especially if you have children, it's always a good idea, or if you're married, always a good idea to have these estate planning conversations, not waiting until, unfortunately, maybe a little too late. Always good to do these things ahead of time. And then we have employee assistance programs, workforce development, benefits offices that may have some benefits. And I know that Wendy is on our call, on our webinar. So I don't know, Wendy, if you are able to maybe unmute yourself, and I don't know if there are any resources specifically for Boston Children's employees that you think would be beneficial for them to know when it comes to elder care.
Hi, good afternoon, everybody. I am Wendy Mateo Arias, and I work in the Workforce Development Program for Human Resources. And I am just here to represent my team and the benefits team that has focused on just connecting with our employees to try to provide a support in a different area than just at work. So the financial well-being programs is one of these initiatives, and partnering with Harvard University, the Employee Credit Union, to have these presentations and guide ourselves and our employees into different topics for the financial areas that really need a focus on, just for us to get some great tips from what Migdalia and her team are doing here, and maybe try to figure a better way how to improve our finance in different areas. So for the topic that Migdalia is talking, we do have as well the employee assistance program that they can provide information and connect you with other resources for the area, like the needs for the elders and what locations might work depending where do you all live, or your parents or the person that you are caring for. So we provide three phone calls with them, and after that they look for resources for you and see what might work the best. So that's one of the things that we have as well with the employee assistance program. And I just want to say thank you very much for joining. We do have more workshops for the rest of the 2022 that focus in other areas. So we hope that you are able to join them if you are interested, and also just share the word with your colleagues. We are here to provide a little bit more of a support on our employees' personal life, and what a great thing that, providing some guidance on the financial area. So thank you very much. And if you have any questions for me, you can please provide it on the chat. Thank you, Migdalia, and to Sarah and Dominic who are here.
Thank you, Wendy. It's always great to hear of the many resources that are available. And, I think I always like to ask folks, when you're on one of our webinars or one of our presentations, I always recommend just having a little bit of a to-do list and knowing one or two things you're going to do in the next week. Like, let's give ourselves some actionable items. And I think reaching out to the employee assistance program that Wendy mentioned is definitely a good resource and a good tangible to-do list item. And with that, I'm going to turn it over now to Sarah, who's going to talk a little bit more about protecting elders from financial abuse, which is a really important piece of caregiving for elders or for ourselves as well.
Thanks so much, Migdalia, and thank you everyone for being here today. I really second everything Migdalia said, and I think especially what she said last, and that's making those actionable next step items. And I'm going to give you a couple of tips throughout our time with the rest of our presentation about things that you can do to set yourself up for success, or set your elder up for success you're caregiving for. And so many of these things don't need to wait until you are older, or if you're caregiving for someone who's older. A lot of these things can be put in place for any age. And I think that's something to recognize as well. Protecting elders from financial abuse is one of the most important things we can do as people who caregive for them. As well as if we are getting older, this is something that we need to be aware of. Last year, it was estimated that $36.4 billion was taken from elders, from victims of elder financial abuse. And that statistic really is mind-blowing, I think, when you think about it, because there are so many different types of elder financial abuse that I think a lot of us don't have the full opportunity to know and to really think through. Unfortunately, most elder financial abuse is done by trusted folks. More than likely, this isn't done by random. Of course, there are those times that this happens, but for all cases brought to the National Center of Aging, it was found that about 80% of these cases were by family members or trusted friends. And so this is just something to begin having conversations about. And it's time to start having those conversations now with everyone in your life, right? I think we can all be better about protecting our information, especially when you get, I don't know how many scam calls you get a day. I probably get, I don't know, between 3 and 5 every single day to my cell phone. So I'm going to go through a couple of different tips on this slide, and then we'll talk more about signs of elder financial abuse, and then wrapping up with what to do if you suspect your elder in your care has been financially abused. Setting up account alerts. I cannot recommend this enough for everyone on the call today. Whether you are older or if you are caregiving for folks who just got their first debit card, this is an important piece of the puzzle for everyone who has a bank account. Setting up account alerts is extremely important and a great way to protect ourselves and to be the first line of defense when it comes to protecting ourselves from any type of financial abuse. Setting up account alerts is extremely simple process for most financial institutions. You can do it right through their online banking service or on your mobile app. And so I highly recommend taking some time to look through that. Maybe that's your first actionable item to take right after this presentation is over, is to go ahead and set up those account alerts. And the reason why I recommend this for protecting yourself is because if someone spends money from your account and you don't know about it, a lot of times, I don't know about you, I don't check my bank statements more than once a month. And so if it's been a full month since someone has taken money out of my account, that gives them more time to then continue scamming people. So that is why you set up account alerts. Credit freezes. Credit freezes can be extremely beneficial for elders because more than likely they are not going to be getting new loan products all the time. And so a credit freeze, what it does is it protects anyone from getting a loan in your name unless they have a PIN number that you've created with each credit bureau. And that is something that I think is very important because most elders are not going and getting new credit cards. And oftentimes it's either young people who are victims of this type of financial abuse or elders because more than likely they aren't applying for new credit, so they may not know that it's happening to them. And so this is really important that you put on a credit freeze. And it used to cost money to put on credit freezes. It is now free. So this would be a good opportunity to just take that extra step. Reviewing and shredding financial information, getting yourself a safe deposit box is a very important step in this. Many financial institutions have safe deposit boxes. This is a great way to keep your information safe as well as secure. So that way, any financial information that is extremely important, I know there are safe deposit boxes in many places, but this keeps it safe and makes sure that no one gets that information that shouldn't have it. And shredding those financial documents that you get. I know that I have officially taken myself off the list for credit card offers, But before, I was having to shred those documents because if it got into the hands of somebody that wanted to take money, it could be a little bit easier for them to do so. So just make sure that you're reviewing those documents and shredding whatever needs to be shredded. Protect your personal information on the phone, online, and in person. This is one of those things that I think with the age of the internet, especially, we kind of forget about our own privacy a lot of times, especially if there's something good that comes from it, right? I know that probably more than once I have submitted my email for something that I really didn't read the fine print on. And so it is really important as we continue to age to be more stingy with our personal information. That's not everybody's business. Um, One thing that I always want to make clear, financial institutions should not be calling you for any type of passwords into your online banking system. Financial institute HBCU will never call anyone and ask for your password into your financial system. And that is really important that you do communicate that clearly to everyone in your life, that banks shouldn't be calling you and asking for passwords to online systems. They may ask you to confirm different things, and they may ask for different ways of setting up your account, but they're never going to ask you for your password. Protecting personal information also comes from making sure that your Wi-Fi is secure and password protected. Um, it is so much easier for scammers to be able to get onto your internet if you don't have a password protecting it. So it is important to do that. And again, I think I say this in every single presentation. If you are out and about and you're on public Wi-Fi, you should not be getting onto your banking apps or checking your credit score, any type of that that you may be doing from day to day. That should all be done on secure, password protected Wi-Fi. Don't rush into financial decisions. This is one of the things that I think can sometimes be hard to understand because there is this emotional piece to a lot of financial abuse. And I think it's difficult to talk about. It's difficult to, I think a lot of folks who are victims of financial abuse don't come forward because it is embarrassing, and it embarrasses them. They don't want to risk a relationship with somebody that they love by accusing them of financial abuse. And so when we think about not rushing into financial decisions, this is something that I think can be one of the most important things we can do in general. Um, there's this effect that comes from people telling you, I'm in a bad place. I really need your help right now, and I need it, today in the next 10 minutes. You have to wire me the money, right? That's an emotional play. That's why it's effective, because we're caring people. We want to help. More than likely, that's our goal, right? We want to help people, and so just I can't uh, encourage you enough to take time to think about these decisions. If you're on the phone with someone and they are saying, you know what, I need that, I need you to wire that money while we're on the phone. And if you tell them, you know what, I'm actually going to take a moment to think about that, and I'll get back to you. I'll call you at the number listed on your website. If it is a scam, more than likely they will not be happy about you doing that. And if it's not, then they will be totally fine with you doing that and taking time and thinking through it. Here at the credit union, there's nothing that we are going to say, like, you need to do this in 10 minutes, right? We're going to say, you know what, it's okay, take your time. And most financial institutions are going to be the same way. And then signing up for FTC fraud alerts. If you are interested in learning more about common scams or fraud that is happening in your community, signing up for FTC fraud alerts can be a good way to educate yourself. You can sign up for those at ftc.org. signs that an elder in your life may be a victim of financial abuse. And something that I want to make clear is that you do not have to have definitive evidence to report this to your local agencies. You can just be suspicious of it to report it, but to take any action further, the elder must also understand what's happening and ask for the help from that local agency. And so, because at the end of the day, this is the power in the hands of the person who it is happening to. So, a couple of signs that you'll see here, but I want to specifically point out a couple. One of them is purchasing of gift cards. Um, this is extremely common, happens to us all, and doesn't just happen to those in our lives who are aging. It happens to everyone. I know just a few weeks ago now, my grandmother called me. I am the resident expert on all things money in my family. And my grandmother called me and she said, Sarah, I got this crazy call the other day. They said that Sam, my brother, was in trouble and he was in jail. And to pay his bail, they needed me to get them Walmart gift cards. And luckily, my grandmother said, let me take some time and I'll get back to you. Because she knew, number one, that my brother probably was not in jail. And number two, she knew that that's not how bail worked. And she took the time to say, you know what, let me step back from this situation and let me call Sam, call people in my family and talk it through with them to make sure that this is a good idea. And I can't say enough how important it is to talk these decisions over with multiple people in your family, not just one or two people, but multiple people. Unplanned wire transfers. Unfortunately, we've seen this at the credit union. And this happens, again, like I said, with unfortunately trusted family members and friends. They feel like they're close with somebody, that they wouldn't do anything to hurt them, and then they wire them money. And unfortunately, a lot of times we cannot get those funds back for them. So look out for these types of things when you are caring for an elder, or if you are aging yourself. If you start noticing that there's someone in your family that's asking you for money all of the time, maybe talk to somebody else in your family and ask, is this person okay? Is there any way else we could help them? And then unfortunately too, I think where the piece comes in with um, make sure that the professionals are certified in being professional with your elder when we talk about alteration of wills or trusts or any of that nature, because those can be extremely devastating once an elder has made those decisions. And so having someone you trust who provides those services and who's certified, who's a fiduciary, they're going to be able to pass this information on to their caregivers and to help them as much as possible with keeping them safe. So if you see any of these things, my first step, and we're going to go on to the next slide if you can, Migdalia, the first step that I would recommend is speaking with the elder that you're caregiving for. It is so important that you ask them questions and say, are you feeling okay? Is something happening that's making you uncomfortable? Because more than likely, they want someone that they can speak with, that they trust, that they love, talking with them and asking them questions. Ask them how they are. If you've seen a lot of bills go unpaid, say, have you been getting your mail? Is there something wrong? Have you been getting your checks? Check in with them and be proactive about it. You don't have to wait until you suspect financial abuse. You can start checking in with them early and often. Like I said, report any potential abuse to their financial institution, lawyers, and others in their network. This is extremely important, especially if you don't live in the same household as the elder you're caregiving for, because there need to be trusted people in their lives that we care for that can help them. And like I said, a fiduciary is a great place to start, like Migdalia mentioned. Um, Lawyers, a good place to start, making sure that they know, you know, I'm pretty nervous that this is going on, and if you could just be on the lookout for it. And then, of course, contacting local authorities and social services. The social services are here for you more than, you know, I think just providing care at a certain point. They are here to say, to give them opportunities for connecting with other elders in their community, and also giving them information like this to protect them. So making sure you're contacting local authorities so that they know that this is happening and can protect others from it happening to them, but also those social services that they can kind of put up a PSA within their community groups that they have going on as well. We've given a lot of information today. The aging process is complicated. It is not something that is easy. It is not something that we need to do alone as caregivers or as those aging. National resources you see here, National Institute on Aging has quite a bit of information for folks who have Alzheimer's or dementia. I know that this is a great resource for my parents as my grandmother battled her Alzheimer's, was seeing new research and seeing learning more about what to do if those types of things do help us to cope with these things, right? So that's a great resource. And then, of course, the National Council on Aging that we have cited quite a few times throughout this presentation, that's also available for folks. AARP to help save us a little bit of money, and the Social Security Administration when it is time to talk more about those benefits and what we have available to us. Massachusetts resources. If you are a Massachusetts resident, they actually have a pretty comprehensive website for seniors and elders in our community, and what resources are available specifically to elders in Massachusetts. Really thorough information about housing, about caregiving. All of those things can be found here, but one of the resources that we didn't put at the end, but we've spoken about throughout our time today, is your EAP, or Employee Assistance Program. I believe at Boston Children's is also KGA, and they can speak with you, like Wendy said, about different options for caregiving for elders. So I highly recommend reaching out if you do have questions. Like I said, support is available, whether that is emotional, medical, that support is available and it's out there. Financial support is also out there. I want to make you aware that here at the credit union, we truly believe that supporting our members is our most important job. And so it is very important that you know you're not alone in this. GreenPath is a great partner as well. GreenPath Financial Wellness, they are a nonprofit. They offer free budgeting, credit, and COVID-19 counseling, as well as federal student loan counseling. This is free for anyone on this webinar and members of your family. Maybe it's time for you to start thinking about caregiving for your elder and moving them to your home, and that's going to look like a different budget for you, and you need help seeing what that will look like. Call GreenPath. It is a completely free service that we pay for here at the credit union so that you are able to get that free one-on-one help. So I can't recommend calling GreenPath enough. We have a blog at the credit union, and I'll be honest, we have some great articles there about aging and elder finances. I know we've written a few on retirement. This is a great place to go for trusted information. If you learn better through reading, our blog is a great free resource that you are free to share with those in your community as well. We mentioned at the beginning, we'd love if you could fill out our survey for us. huecu.org/survey. It should only take you just a couple of moments. So if you could, please fill that out for us and let us know if there's anything else that we can do to continue making these presentations a success. Course, myself and Magdalia, we aren't lawyers, we're not tax advisors, we are not investment advisors. This is more of a general overview to try to help you with those larger questions in your life. We don't know your background, we don't know your history, so we can't give specific advice, but we hope that this presentation has been helpful for you to learn more about how you can partner with many different trusted advisors, fiduciaries, even in your life to make these decisions for yourself and for those around you. HUECU is here for you. Whether you are a member or not, we are here. And if you are a member, thank you for being a member. We appreciate that, and we are so glad you're here with us. You can find us on all social media channels at myhuecu. And this is a great place to go if you're interested in keeping up with us and seeing what new articles we have or anything of that nature. So we look forward to our presentations in the future with Boston Children's Hospital. Again, you can find our presentation series at huecu.org/Boston-Children's. So please don't hesitate to register for those in the future. And we look forward to hosting you all again in just a couple of months. Hope you have a wonderful day. Thank you all so much.